Hi, have you heard about sinusitis? If not, let's learn.
What is sinusitis? Sinusitis is an inflammation or swelling of the nasal passages, sinuses, which is usually caused by an infection. As we can see from the diagram, there is inflammation and excess mucus in the nasal passages when someone has sinusitis.
Types and duration of sinusitis. There are 4 types of sinusitis, which includes acute, subacute, chronic, and recurrent sinusitis, which only differ in their duration when having the symptoms. First is acute sinusitis, where the symptoms last for 4 weeks. Next, for subacute sinusitis, it only lasts less than 12 weeks, while for chronic, the symptoms last more than 12 weeks. Lastly is recurrent sinusitis, in which the symptoms come and go back to normal in between with multiple episodes.
Etiology, also known as the causes of sinusitis. Sinusitis may be caused by anything that interferes with the airflow into the sinuses and the drainage of mucus out of the sinuses. The sinus openings, posterior, may be blocked by swelling of the tissue lining and adjacent nasal passage tissue. There are various causes of sinusitis. First, it may be due to airborne, such as air pollution, where this interferes with the airflow of sinuses, smoking, and pollen, which can enter sinuses in allergic person. Sinusitis can also be caused by infection due to viruses, bacteria, and also fungi. Next, structure of the nose can also cause sinusitis to occur. For example, nasal polyps, where tissue growth in sinuses can block the sinuses, and deviated nasal septum, where it restricts or blocks sinus passages, making the symptoms of sinusitis worsen. Other than that, asthma and a low immune system like AIDS can also lead to sinusitis. How does sinusitis occur, or also known as pathophysiology of sinusitis? Sinuses are located in the face and the skull. There are 4 pairs of sinuses located on the either side of the head. There are frontal, maxillary, F1, and sphenoid sinuses. Sinuses are lined with respiratory epithelium producing mucus. This mucus will drain into the nasal cavity through a small opening called ostia. Impaired sinus drainage was associated with inflammation of the sinuses, which can block the ostia. Fluids build up in the sinus, making it a favorable environment for bacteria to grow, which can lead to infection. And this condition is known as sinusitis. What are the signs and symptoms for sinusitis and sinus infections? So, there are many signs and symptoms of sinusitis and sinus infections. Most patients have several signs and symptoms at the same time. Meanwhile, others have some symptoms that are intermittent. However, most people do not have all symptoms at once. The signs and symptoms of a sinus infection or sinusitis include nasal discharge, cough, headache, facial tenderness, sneezing, bad breath.
It also include loss sense of taste and smell, fever, stuffy nose, fatigue, sore throat, and toothache.
Next, let's move on to risk factor. Risk factors for sinusitis include, firstly is age. In general, elderly people and young people have a higher risk of developing acute bronchitis, including sinusitis. People who have certain medical conditions, such as recent flu, medicines such as prolonged use of decongestant sprays, nasal obstruction, people that have any allergies, certain chronic illnesses such as diabetes and HIV infection, increase the chances of getting sinusitis. Smoking and being exposed to secondhand smoke increase the risk of developing sinusitis. For gender, women have a greater chance of developing sinusitis than men. Next is ethnic background. Whites and black have a higher risk of developing sinusitis than do Hispanics. For environmental factors, people that travel to high altitudes, living in areas that have air pollution, and living in the Midwest or Southern US are likely to have sinusitis. Lastly is activities. Do activities such as flying and diving both increase the chance of getting sinusitis.
Secondary problems of sinusitis. Although most cases of sinus infections are uncomplicated, potentially life-threatening complications of acute bacterial sinusitis can occur. This is because the walls of the sinuses are thin, and the sinuses share blood vessels and lymph drainage pathways with the eyes and parts of the central nervous system. Complications of sinusitis include infection of the eye and its surrounding tissue, sinus cavity blood clot, thrombosis, brain infection, pus in the brain, and bone infection.
Do you know that there are several conditions that can cause misdiagnosis for sinusitis? For example, viral upper respiratory tract infections or URI. Basically, it may include viral acute sinusitis, but viral URI are more common, and the symptoms improve within 3 to 5 days, whereas sinus infections can persist beyond this time. Besides allergic rhinitis, which is an inflammation of the nasal mucosa without infections, the symptoms include allergic features such as watery eyes, itchy nose, and sneezing. And it usually causes clear nasal drainage, whereas sinusitis usually involve a large amount of yellow or green nasal discharge. Next, non-sinogenic facial pain such as migraines, tension headache, cluster headache, and others. These conditions include symptoms such as facial pain and pressure, but with the absence of any nasal symptoms or signs. Let's moving on. There are several treatments to treat sinusitis. First is nasal saline spray. It works by rinsing and moisturizing the nostril, thus relieve the stuffiness so that breathing becomes easier. For nasal saline spray, 2 sprays are instilled in each nostril 3 times a day or as needed. Next, nasal corticosteroid, which helps in reducing the inflammation and swelling in the sinuses, which making it easier for the nasal mucus to drain into the stomach. It also minimizes the pain by reducing the pressure in the sinuses. For example, is budesonide nasal spray. For this, 2 sprays are instilled in each nostril once daily. Next is antihistamine, which is used in treating sinus infection due to allergy. It acts by blocking histamine binding to peripheral histamine receptors, thus reducing the allergy symptoms. For example, is cetirizine tablet, and the dose for children between 6 until 12 years is 5 mg twice daily. And here is decongestant, which are used to reduce swelling and allow sinuses to drain by narrowing the blood vessels. For example, is phenylephrine hydrochloride nasal spray. For this, 2 to 3 sprays are instilled in each nostril 4 hourly as needed up for 3 days. Lastly, antibiotics were only given when bacterial infection is present, and it works by stopping the growth of the bacteria. Sinusitis usually get better on its own. However, there are some things that we can do to speed up the recovery process and relieve the symptoms. First, get plenty of rest. Second, drink plenty of warm water to help the mucus to be thin and making it drain more easily. Third, you can seek steam sinus cavities by breathing in the vapor from a bowl of hot water. This will help to ease the pain and drain the mucus. Fourth, put a warm compress on the face to ease sinus and facial pain. Next, take a hot shower to relieve pain, promote drainage, and open up sinus cavities. Next, rinse out nasal passages to drain and clean the sinuses. And also, you can sleep with your head elevated to breathe more comfortably while sleeping. Can we prevent sinusitis? The answer is yes. There are a few methods that help in reducing the risk of getting sinus infections. First, avoid upper respiratory tract infection by staying away from people who have colds. Next is avoiding cigarette, smoke, and polluted air because it can irritate and inflame the lungs and nasal passages. In addition, use a humidifier because dry air may increase sinus pressure and cause headache and throbbing pain. And by using a humidifier, it helps add moisture into the air and may help in thinning the mucus. And lastly, drinking plenty of water, which can help in reduce blockage in the sinus. That's all about sinusitis from us. Thanks for watching and goodbye.